Hey folks, I'm Howard Lux.
And I'm Jeff Berg.
We are the two boneheads. We're going to talk to you today about the return to sports after an ACL reconstruction. Too many kids and too many parents and too many people in general think you tore your ACL, you have your ACL surgery, everything's great, and you go back to sports. Well, we're here to tell you that's not how it happens. And unfortunately, a number of you are going to re-injure yourself. We're going to talk about what those risk factors are. So, Jeff, returning to sports after ACL surgery, is it physical? Is it mental? Is it emotional? Is it psychological? Are we waiting? What are we waiting for? Why does it take so long?
Yeah, the answer to your multiple questions is yes. It's all those things. So, just athletic endeavors in general are all those things. And basically, you're taking somebody who, was athletic or active in some way, and they've just taken a big hit. They took a big hit from their injury, and then they took a big hit from your surgery, and that hits physical and mental. In many of these people, it's a big blow to them mentally, and now you're trying to get them back to a level that is pretty exceptional. I mean, if you think about what you have to do in a sporting environment, it's pretty exceptional. And for years, the thought was that we could just put a new ligament in your knee, and then you go, like you said. But we're realizing that there's more to it. And unfortunately, that probably takes more time than we've have been giving it in the past and that most of our patients expect.
Right. So let's break this down. So the talk that's most difficult to have is biology, right? The biology of tendon healing or graft healing. A lot of kids think that if they pound away at the gym, they get their strength back or they get the agility back. And we'll talk about why that's a fallacy to begin with. They think they're ready to go back. What are we waiting for, actually?
So biology. So we know that when we put that graft in there, we've killed its blood supply. And that blood supply has to come back. And then that blood supply feeds that tissue that we put in there. And over time, and it's estimated somewhere between a year and 2 years, and perhaps it could even be longer. I mean, a lot of these studies are generated from animal studies, not humans. That graft thickens, becomes more like its native ligament, gets stronger, and that's just the biology part. But there's also the psychology part, and there's also the sort of what we call proprioceptive, where your knee is in space and how to use your leg and how to land on it and all these factors, and they all take time. And unfortunately, some of them you have to develop in series. Before that graft is strong enough, there's only so much stress you can put on it. So this all takes time.
Right. So from a biological perspective, folks, your graft, your new ACL graft is actually weaker between 3 and 4 months after the surgery than it was when we put it in. That's because all these new blood vessels that Jeff described have grown into the new graft, and it's actually replaced a lot of the tissue. So it's going to take time for that graft to bulk up and become a ligament that is capable of allowing you to return to sports. Now, the psychological issue, I think that's one of the most misunderstood aspects of the recovery. We all have our kids who kill it and they're ready and they go back and they want to go back at 6 months, 8 months, etc. But then we have these kids that even a year after surgery, their knee is stable, their x-rays look fine, their MRI looks fine. They don't have pain, but they can't do it. They can't go back. Thoughts?
Yeah.
Do you see this?
Yeah, well, I do. I mean, I see. So I think, like most things, you can have problems on both sides of it. In that particular case, I've seen some people, not only is there anxiety that this may occur again or a fear, but some people will develop depression.
Yeah.
So, if you think about it, a lot of athletes, their whole life is wrapped up, particularly the younger athlete in high school, their whole life and who they are is wrapped up in their sport. And you've now taken that away. And sometimes those patients will go into a real funk and they'll become clinically depressed. I've had to refer some to some child psychiatrists for brief treatments. And then, fear it's going to happen again, anxiety. And these are big things. Like you said, some of these knees rock solid stable, and yet they don't really feel like they can go back, or they'll tell you they don't want to go back.
Right.
I think a lot of that is fear.
Yeah, this is a big problem, and it's a problem that I think that we have a role in. In terms of trying to move the patient past the fact that they have this tear, get past this damaged feeling. You're not damaged. You can get past this. I agree with the depression, etc., and we absolutely have to jump on that when we see it. But I see these ACLs. I don't know what your post-op regimen is, but I don't use a brace. I don't use anything. I make them use crutches, and I put Band-Aids over their knee. Because you see these kids who come out of the operating room sometimes, and they have the ice machine, 3 ACE bandages, this giant bulky dressing, and this brace. And I think we're sending a message to these patients that you're careful, you're damaged, your knee can't handle anything. So I don't know whether the appearance has, a role in that, how we share instructions with them. I don't know.
Yeah, well, I mean, it goes both ways, right? Because I also get the patient who thinks if I'm just gung-ho and go at it 100%, I'll be good too, and I got to worry about them doing too much. Yeah. So you have to balance it a little bit. And I too don't use a brace, and I only use crutches till the patient's safe. But at the same time, I don't want that person to think, as soon as you feel good, you're good, because as you brought up, there's the biology.
Yep.
I don't care how strong you are, how confident you are, how athletic you feel.
Yep.
That graft's still healing, and that's one we can't control. So it goes both ways, and you have to be careful. And I think, unfortunately, there was this thought for a long time that we could get these people back really quick. And people will still refer to me, oh, yeah, but professional athletes get back right away. But if you really look at it, they'll take a year.
Yep.
They'll take 10 months, 11 months. And it hasn't caught on, and hopefully this talk will help, but it hasn't caught on with our patients that the real rehab for this is a lot longer than the 3 and 4 months that we used to do.
Absolutely. And the actual return to sports rate isn't as high as you think it is. Returning at the same or greater level is, depending on the paper you read, 60, 65, 80 at most. And unfortunately, if you do go back too soon and your knee is not ready, your risk of re-injury can be anywhere from 20 to 50%.
Right. And you and I know when you have that second injury, and now you've done some damage to your meniscus, you're in a whole different place. So I've slowed down my patients' expectations, protocols, because I think, as we're sort of talking about, we got to get not only the graft to mature, the knee to function properly, and the patient to get over their fear and anxiety. Because in any sport, right? If you're anxious, you're going to miss the shot. You're going to sustain an injury. And if you're anxious when you're coming back from surgery, you're more likely to have an injury. So there's a whole bunch of things that we have to address, and it's not cookie cutter, and each patient is different, and it clearly takes a lot longer than we used to think.
Agreed. And we have to work real closely with our therapists and trainers too, because, your knee extension strength doesn't matter. Strength is but one small part of the overall recovery process.
Absolutely.
The agility and landing skills and jumping skills and cutting skills, it's critical, because at best, you have an 15 to 18% chance of injuring the new ACL or your other one. And so anything that you can do from a preventative perspective of avoiding another operation is key.
Absolutely.
All right, folks. We gave you a little bit of useful information. Return to sports today after an ACL reconstruction. Take care.
Bye-bye now.